Well, this is really, important and exciting news.
Cameron Webb, who sits on the White House COVID-19 response team, is elated by the news youngsters may be eligible for the COVID vaccine as soon as next week. Of course, there are a few formalities still to get through, but Webb doesn't anticipate any major snags.
We're hoping everything moves smoothly. We certainly don't want to prejudge the outcome. That's what that whole scientific process is for. But this is good news as this continues to move forward.
We're talking about kids between the ages of 6 months and 5 years finally getting the opportunity at a shot in the arm.
And I think it really offers, parents an additional tool to provide that additional protection for their children.
Dr. Katie Scharf, Chief of Infectious Disease at Kaiser Permanente Northwest, says there's no right or wrong answer when it comes to vaccinating your young child. In fact, this population, she says, is at a lower risk of becoming severely ill with COVID. All of that said, Dr. Scharf indicates Omicron subvariants BA4 and BA5 are on the rise in our community.
They are more transmissible, 8 to 12% more transmissible than the current Omicron variant that's circulating. And additionally, they they can evade prior immunities.
Something to keep in mind as you weigh the pros and cons of vaccinating your young kids.
We actually have secured enough vaccines for all children in this age range, so there's no concerns about a bottleneck of access from a supply side.
All right, I did reach out to the Oregon Health Authority, and they told us they are well positioned to vaccinate the youngest here in Oregon. They said they will be prioritizing equity and getting the first doses of the vaccine to tribal providers and federally qualified health centers, among others. But at the end of the day, if you are interested in getting a vaccine for your child, you should have no problem doing so. Reporting in the newsroom, I'm Mike Benner for KGW News.